Yo.
Oh no!
That's
Are you okay? Oh no, do you think he's okay? I don't know. Why don't we examine his body in anatomical position? This is his right side and this is his left.
I hope his exoskeleton's okay.
What's that?
It's his head, neck, and trunk of his body.
What about his appendicular skeleton?
The what?
The appendicular skeleton is the appendages or limbs of the body, so his arms and legs.
Oh, I think that's what got hurt. We have to compare the parts of the body using anatomical terms.
Oh, like how superior means closer to the head? Like the eyes are superior to the nose?
Yes, and the ankle is inferior to the stomach or farther away from the head.
Anterior means closer to the front of the body, so the spleen is anterior to the spine. The opposite is posterior or closer to the back of the body. For example, the tailbone is posterior to the sternum.
If something is in the middle of your body, it's medial, like your trachea is medial to your wrist. Your hip is lateral to your bladder, meaning it's farther away from your midline.
If something is closer to the limb's attaching point, it's proximal. The elbow is proximal to the wrist. On the other hand, distal is when something is farther away from the limb's attaching point. So like how the ankle is distal to the femur.
The rib cage is superficial to the heart or closer to the surface. The blood vessels are deep to the skin or farther away from the body surface.
Was there any damage to the dorsal cavity?
What's that?
It protects the nervous system. It's divided into two sections. First, there's the cranial cavity, which is where the skull encases the brain. And second is the vertebral cavity, which includes the vertebral column and encases the spinal cord. What about the ventral cavity?
It splits into the thoracic and abdominopelvic cavities, meaning the area anterior to the dorsal cavity, containing the internal organs. The thoracic cavity includes the heart and lungs, and the abdominopelvic cavity includes the area below the thoracic, containing the abdominal and pelvic regions. Structures located in the abdominal cavity are the stomach, intestines, spleen, and liver. Those in the pelvic cavity include the bladder, reproductive organs, and rectum.
We can further examine them based on the body planes.
You're right. The sagittal plane is splitting the body into right and left parts, and the mid-sagittal plane is when it's split down the midline.
The frontal plane is splitting the body into anterior and posterior parts.
The transverse plane divides the body into superior and inferior parts. The body can be divided into quadrants in order to specify locations of organs in the body.
The right upper quadrant is the section on the right side of the body in anatomical position that is just below the ribs.
This quadrant includes the right portion of the liver, gallbladder, right kidney, and small sections of the stomach and small intestines.
The left upper quadrant is the opposite of the right upper quadrant, located on the left side of the body in anatomical position.
This includes the left portion of the liver, most of the stomach, spleen, left kidney, and parts of the small intestine.
The right lower quadrant sits right below the right upper quadrant.
This quadrant has structures like the appendix and upper portion of the colon.
The fourth quadrant is the left lower quadrant, located on the opposite side of the right lower quadrant and directly below the left upper quadrant.
This includes structures like portions of the colon.
As these four quadrants can be useful, they can be further divided into a total of 9 sections. The right hypochondriac region is below the cartilage of the lower ribs on the right side of the body in anatomical position.
The epigastric region is located above the stomach in the middle of the body.
The left hypochondriac region is located on the left side of the body in anatomical position, directly next to the epigastric region.
The right lumbar region is located just beneath the right hypochondriac region.
The umbilical region is below the epigastric region and is located near your belly button.
The left lumbar region is located directly below the left hypochondriac region.
The right iliac region is below the right lumbar region, also known as the right inguinal or groin area.
The hypogastric region is below the stomach, underneath the umbilical region, and also known as the pubic area.
Finally, the left iliac region is below the left lumbar region and is also known as the left inguinal or groin area.